So it is 12:33. We'll get started as the rest of the people filter in. I want to welcome everyone today. I'm Cynthia Mahoney, here with my co-leads Margie Chen and Karina Mayer for the Voting for Climate and Health team. And along with Climate Health Now, we are so pleased to welcome you today. Housekeeping to start, please post your name, pronouns, city, and state in the chat. That helps us build our community. You can enter any questions into the chat as they occur to you. Karina will monitor the chat and moderate the Q&A segment. We will be posting links to references and resources in the chat, but don't worry about copying them. We will send them out again with the recording after the webinar. I want to start by thanking our co-sponsors, especially the Medical Society Consortium, who's hosting the Zoom today, Vot-ER, Climate Psychiatry Alliance, one of our early supporters, the local PSR chapters, and the California Nurses for Environmental Health and Justice. Our agenda today will be reviewing the AMA resolutions and then showing how health professionals can advocate around this. We'll introduce you to Vot-ER and their tools and help you take some action. And then we should have about 10 minutes for Q&A at the end. Before I turn things over to Margie to introduce our speakers, I want to give a little background about why we're here and our goals for the webinar about urgency, agency, and hope. So Climate Health Now formed in support of the student climate strike back in 2019. We were so happy to find each other, a group of health professionals who understand climate change as a threat to the people and places we love, and who want to use our trusted voices to advocate for effective and equitable climate action. We knew it was important to encourage patients to elect leaders who would act on climate. When COVID struck, the very act of voting itself was a direct health hazard. It was untenable that people should have to risk their health in order to vote. So we joined forces with the Union of Concerned Scientists to encourage no excuse mail-in voting across the US. That was an eye-opener for us. We were appalled and outraged by what we saw, the rampant voter suppression and the efforts by powerful forces to undermine democracy itself. We learned that voting is a social determinant of health. We simply can't accomplish all the things we need to protect health and preserve a livable climate without a healthy democracy where all voices are heard. That's when we changed course to work on nonpartisan healthcare-based civic engagement with Vot-ER and connecting voting to climate action. As health professionals, our superpower is our trusted voice. Our patient superpower is voting. We have a unique connection to patients, especially those who may be inconsistent or unregistered voters, while at the same time are often the most harmed by fossil fuel pollution and climate change. We can help them unleash their superpowers by encouraging them to register and vote in every election and educate them on how their vote impacts their environment and their health. Now, some health professionals and healthcare institutions have been reluctant to engage in this effort, afraid it's too political. And that's why we were thrilled when the American Medical Association passed 2 resolutions in June, that climate change is a public health crisis and that voting is a social determinant of health. Our goal today is to show the connection between climate action and the power of healthcare-based civic engagement, and why health professionals not only can, but should work in this space. We want to motivate you with urgency, equip you with tools for agency, and generate hope with collective action. By the time you leave, you should be recommitted to using the health voice for climate action, to unleashing our patients' voices with civic engagement. You should feel comfortable that this is our lane and confident in using these tools. Now I'll turn over to Margie to introduce our 3 stellar guest speakers.
We are honored to have these extraordinary speakers to enlighten us today. Our first speaker is Dr. Ashley McClure, who is a practicing primary care physician at Kaiser Permanente in Oakland, California. She co-founded Climate Health Now in 2019 with Dr. Amanda Milstein. Climate Health Now has grown to over 600 health professionals all over California. She is a CMA and AMA alternate delegate and was co-author of the AMA resolution, Climate Change is a Public Health Crisis. She is producer and host of the podcast Courageous Medicine for the Climate Health Crisis, Activating the Medical Community on Climate. During maternity leave in November 2018, Ashley had her climate awakening. Breathing in toxic, polluted wildfire smoke, she realized that her sweet college future and health was incompatible with a fossil-fueled business as usual world. She reoriented her life to do everything possible to leverage the medical community to advocate for climate justice solutions to protect the health of all children and humanity. Ashley, do you want to share your slides?
I do. I would love to. Thank you for the gracious introduction. I'm really glad to be here with you. Let me see. So getting set up. Okay. So I was invited to share about this, the resolution we got passed this past June at the AMA's meeting about declaring climate change as a health crisis. And I'm really honored to be here, and thank you for the invitation. So the reason that I've started to put a lot of energy and time into bringing climate up the list of priorities in the AMA is because it's an enormous institution with a lot of influence. And many of you may already know this, but I didn't, that the AMA is the only medical association in the US that convenes over 190 state and specialty medical societies with other key stakeholders, and has a really big influence. Going, because of where I worked, Kaiser Permanente in Northern California, we have an institutional membership. So I didn't seek out organized medicine. I kind of wish I had sooner, but I just sort of fell into it because we had that membership. And the more I learned about it, the more I realized it was a really big opportunity. So I have a little question for anybody. Does anybody want to guess, in terms of federal lobby interests in DC, what number do you think AMA is on the list of lobby influencers in terms of federal spending, lobby spending? I can't see the chat, but you can just speak it out if you want. 120? Fifth? Yeah, so closer to 5 is the 8th largest lobby in DC. And whether we're trying to bring about climate action, we can obviously affect who we vote for, but also who's influencing who we have voted for. So US Chamber of Commerce is number 1. Interestingly, the American Hospital Association leads ahead, and then Facebook or Meta is above, but then it's AMA. And I think that, roughly $20 million that they're spending influencing federal electeds is kind of what we're trying to affect with the policy that they're lobbying for or against. And then this is my last pop quiz. Anybody want to guess on how many lobbyists AMA has running around the Capitol trying to influence policies? I was also shocked by this.
60.
25. So closer to 60, 1 for every state and then a couple. So 52 people their sole job is lobbying in the interest of the AMA. And the AMA has a pretty checkered past. People of color couldn't be members as few as 50 years ago or so, and it has a lot of racist, unsavory history. And we have the opportunity to change it, and that's really what we were trying to do with this resolution. So the policy, the way it came about is that we looked at the policy finder that has all of the AMA's policies, which enable those 52 lobbyists spending $20 million to advocate for or against certain policies and legislation. And the AMA hadn't declared that climate change was a crisis. So that was obviously the first place to start. And the precedent that we looked at is that the CMA, had recently declared that the opioid epidemic was a crisis. So that was kind of the precedent of we need to just name this as an emergency. And we had to introduce it 3 times. The COVID pandemic and the virtual nature made it hard, but we introduced it 3 times before it was passed. So it wasn't a slam dunk on the first go round. But my main kind of lesson that I learned from it was the coalition building before even the meeting happened, like 6 months or even more before the meeting happened. And a big part of that was bringing in the climate community, which we reached especially into the Medical Society Consortium's community, and found colleagues that were already activated on climate and generally more, social justice really, but reaching out to them and then asking them to reach out to their state medical societies leaders or specialty societies leaders who often were part of the AMA delegation. So AAP has a delegation to the AMA, the American College of Physicians, American Women's Medical Association, they all have delegations. And so we activated those relationships we have around climate and broader social justice issues, and then they asked their delegations if they would consider co-sponsoring. So we went into the June meeting with California introducing it, which took a lot of work on coalition building. 11 states introduced it, and then 2 specialty delegations as co-sponsors. So that really kind of brought the momentum in. And notably, the only opposition to the resolution was, as you may have guessed, from Texas, but they were the only ones who spoke against it. And just super briefly, what's in the resolution, first of all, is declaring that it's a public health crisis. The second one is really just focused on aligning the AMA's lobby work and advocacy work around the Paris climate goals of the international agreements. And then the third one, which kind of gets to my last point, is calling for the AMA to develop a strategic plan for how to enact our existing policies and to identify advocacy priorities, and also strategies to decarbonize healthcare. And there's going to be a report back next year with that strategic plan, which we're all on the edge of our seats about and contributing to the development of with the AMA staff. And then finally, just a little example of kind of what this has already done and what having this policy is going to enable the AMA to do. I want to show you the next one first. So just a couple days, not going forward, after the policy was passed. So on June 30th, when SCOTUS started its conservative agenda, process, the AMA came out with a statement that about limiting the EPA's ability to regulate greenhouse gases and how that's at odds with public health. And this is from the president of the AMA, and many colleagues share my sense that this statement wouldn't have come out from the AMA if we hadn't just passed that resolution declaring climate change a health crisis and the rest. And then just today, literally, one of my dearest partners in AMA work, Jerry Abraham, he was featured in an interview with AMA staff about climate change and health equity issues. So it's pretty clearly started to have an influence on what the AMA is focusing on. And this is just kind of statements, but the real goal obviously is, I don't know if the AMA was involved in like Inflation Reduction Act lobbying and to what degree they weighed in on climate, but the goal is that we continue to build that momentum so that those 52 lobbyists are spending those $20 million to advance health equity broadly, but also really specifically climate action. So that's what I had to share, and I'm really glad to be here with you all. Margie, we can't hear you.
Thank you. Thank you, Ashley, for that inspiring talk that we can make a difference. Our second speaker is Jasmine Eatman. Jasmine is currently a fourth-year medical student and PhD candidate at Emory University. Jasmine has received so many accolades and leadership positions that it's too extensive to list in a short bio. As president of Emory's chapter of the Student National Medical Association, she pushed the Board of Commissioners of DeKalb and Fulton counties to declare that racism is a public health crisis. She was a key partner in passing the AMA's resolution, Voting is a Social Determinant of Health. She is currently a Vot-ER intern. Jasmine is passionate about advocating for patient care around the social determinants of health. She wants to encourage our healthcare community to acknowledge the importance of holistic care of our patients by understanding their unique backgrounds and experiences. The only way to make lasting change is to speak up and out on all forms of inequity so that every person has an opportunity to thrive. Jasmine, you can share your slides too.
Thank you so much. I will go ahead and do so. Thank you all for having me today. I really appreciate the opportunity to share. Hope everyone can see these slides all right. So what I'll do, my portion of this presentation, or the entire event rather, is going to be in two parts. So I'm going to start just with an overview of voting and social determinants of health, and voting as a social determinant of health. As was mentioned, I was one of the lead authors on the resolution and one of the members of the team who was able to actually go to the American Medical Association's annual meeting and testify. We had a whole lot of awesome supporters, and so I'll go through that process a little bit as well. So just a bit of an agenda, as I mentioned, going to go through first voting as a social determinant of health. And so this screenshot here is directly from the US Department of Health and Human Services website. Those are the folks who tell us what social determinants of health are, tell us how worried to be about them, and also give some insight into what our approach should be in addressing them. And so I wanted to go over the broad, I'll say, categories of social determinants of health. This is not an exhaustive list. I do want to emphasize that each of these categories have different individual social determinants of health under them. So we have education, access, and quality, healthcare and quality, neighborhood and built environment. We have social and community contexts, as well as economic stability. So voting is one of those social determinants of health that sometimes can be really difficult to place. And so that's part of what our motivation was behind going to the AMA and arguing that this is important to address as a social determinant of health, because it does affect so much as it relates to our patients' lives, as well as their prognoses and health outcomes. So when we think about social determinants of health and where they land, we sometimes would like, it makes it easier rather to think about it as a spectrum. And we have social determinants of health being the causes of poor health. However, upstream of these are structural determinants of health. So when we think about structural determinants of health, we think about things like racism, classism, capitalism, a lot of the issues, structurally we talk about, I know that Dr. McClure just mentioned the Supreme Court's decisions that have just come out, right? So we have political kind of governing bodies and federal mandates that provide us structures that sometimes work and sometimes don't work. And so these can be upstream causes. When we talk about voting as a social determinant of health, the reason that we didn't title the resolution barriers to voting as social determinants of health or access to voting as social determinants of health is because really your relationship with voting depends on a lot more than what your individual barriers are or what your history of access to is to voting. It really kind of boils down to how is it that I am empowered to vote and how much do I believe my vote counts. We also have health-related social needs, which is, for example, like accessing your prescriptions, right? We can write prescriptions for patients all day long, but do they have a pharmacy within a reasonable distance? Are they able to afford their medication? So we can break voting down, or we can break social determinants of health down into upstream and downstream causes, and voting kind of fits in this framework really well. So voting as a social determinant of health was passed by the American Medical Association's House of Delegates. This was resolution 422. It was a really, really exciting process. As a medical student, as was mentioned, I'm a fourth year medical student, but I'm actually starting my PhD in my fourth year. So I'm in the Department of Environmental Health here at the Rollins School of Public Health at Emory. And so the issues of climate, right, social determinants of health, social needs, these are really important to me. And that's part of why I was really invested in this and why I'm really excited to have seen it pass. And so I do want to emphasize here and highlight that medical students were instrumental in the creation of this resolution. And so you can see we've gone through a lot, we went through a lot of editing, we went through a lot of revisions, but I do want to mention that the medical student section and individual medical students from all regions of the country were involved in the creation of the verbiage around voting and in brainstorming together why voting is a social determinant of health. And so I just want to elevate medical students and trainees, not only because I am one, but because oftentimes we think that we have to wait to make our impact until we're attending physicians or beyond, or until we decide to go into policy work as physicians. But really, we can and do start our involvement in this work, during our formative years. So according to the US Census Bureau, and this is some readily accessible data, we find that voter turnout increases as voter income increases. We see that these trends kind of follow also for different social determinants of health. So whether that's education, income, we see that as those who are able to access more and more education, more and more income, we see that voting rates increase. And so why is this a problem, or why is this important? I'll go back. This is important because we know that the more people are empowered to vote, the more they are able to influence the outcome of what their representatives focus on. So whether that's food access, whether that's insurance, public insurance specifically, it's very important that voters are able to make their voices heard and hold their representatives accountable. So when only certain segments of our society vote, we really are seeing, generally we see a trend that our representatives are only advocating for that certain segment of society's values or their interests. And so we don't want our representatives to only advocate for the most wealthy or the most educated. We want them to be able to advocate for everyone. And so speaking of speaking of trainees and our importance in this work, I do want to highlight the Association of American Medical Colleges actually recently came out with some guidance for medical schools and teaching hospitals on voter registration. And I encourage everyone to look at this. This was actually released after our resolution passed as well. And so that was really exciting. This kind of goes into more linkage between voting and health. This is really important, so I will pause here just so that everyone sees this Health and Democracy Index. This was born out of the Healthy Democracy, Healthy Peoples campaign. I encourage you to look it up. It really does correlate health, democracy, and voting, and it's really important to know where your state is in this whole scheme so that you can kind of focus your investment in this work. So I'll pause here. I know that I'm probably running out of time, and I'm going to circle back to share a little bit more about Vot-ER. Thank you all so much.
Thank you, Jasmine, for that illuminating talk. Our next speaker is Dr. Lisa Patel. Dr. Patel is a clinical assistant professor of pediatrics at Stanford and a practicing pediatrician. She is the current deputy executive director of the Medical Society Consortium on Climate and Health. Among many other responsibilities, she's also co-director of the Climate Health and Equity Task Force at Sean N. Parker Center for Allergy and Asthma Research. Lisa was inspired by seeing Jodie Foster as Dr. Ellie Arroway in the movie Contact. This introduction to Carl Sagan and the wondrous world beyond made her realize that we as humans are only a teeny part of this vast universe, but that we humans have had an enormous role in destroying our home. This activated her to be a guardian for the health of our patients and galaxy. Lisa, you want to share your slides?
Yeah. First, I just really want to applaud both the work of Jasmine and Ashley. So at the consortium, we basically try to speak as the House of Medicine as one on climate and health. And so we convene 42 major medical societies around it. And AMA is really considered the gorilla in the room. So the ability to influence their policies, both on voting and climate change, is a big deal. And so congratulations on this really important work. So I'm just going to briefly talk about why climate change is absolutely, Ashley made the comment that our Texan colleagues at the AMA conference felt as though climate change was not in our lane. I'm going to provide a series of arguments why I disagree with that. First, I just want to set a little context for what the data says about climate change and public perception. So I actually grew up in Texas amongst a lot of colleagues who thought climate change was a hoax, thought it wasn't happening. And this narrative seems to be pervasive, even though the data doesn't bear it out. You can see that there is broad concern and worry for climate change across the American population. There is certainly a partisan divide in terms of who is more concerned and who is less, but 65% of the country right now is worried about climate change. And we've seen those numbers creep up as people are experiencing the health impacts of climate change. It has become undeniable. There's also broad public support for climate change policy. So in terms of funding research on renewable energy sources, regulating carbon dioxide as a pollutant, you can see that a majority of Americans actually support these policies. So why is it that it took until 2022 to start passing pretty significant climate legislation? So if folks probably know that last week, what was called the Inflation Reduction Act is actually the most significant investment that the the US government has made to date on climate change passed in 2022, which is a huge achievement. But when we've known that climate change was an issue since 1960, why did it take us so long to start making these investments? And here are a few of the reasons. First, the fossil fuel industry has lobbied for votes amongst our decision makers and run public education campaigns to really stymie climate action. Climate change, while initially enjoying broad bipartisan support, there were several early Republican presidents that actually supported climate action. It, like many health issues, became very politicized, and the science behind it doubted. Our elected leaders may not see this as an issue that voters actually care about, despite the fact that Environmental Voter Project, which also does really great work in the space, has identified that there were 8 million registered voters that identify as environmentalists that did not vote in the 2020 presidential election. So there is vast potential here to take what public concern is, what public support is for policies, and really turn out that vote for health. Climate change will be the single greatest determinant of health for a child born today. This is the Lancet countdown that's really looking at what is this world we're creating? Are we creating a world where we are really just making a world where children can merely survive? Or do we want to create a world where children can actually thrive? And when we look at the effects of worsening heat waves, worsening access to water, good drinking water, worsening superstorms that are displacing communities time and again, wildfires, which are expected to be the predominant source of air pollution we are breathing by the end of the century. South Asia, which is that looks like in our modeling will be uninhabitable as we reach 2050 without climate action. We understand that this will be profoundly disruptive to a future of health. And I think Jasmine mentioned, as we look to the structural reasons, the policies, there is a really terrible loop here where the sites of fossil fuel combustion, extraction, and refinement is not accidental. They're most often placed in communities that have been politically disenfranchised. And so when these very communities, we've disenfranchised them to vote, either by access to being able to vote, then we perpetuate the ability for these polluting industries to be in communities that are already dealing with a disproportionate amount of pollution. And that's why it's so important to do all we can as physicians to drive out the vote. There's also broad support in terms of medical schools and medical societies, understanding the importance of these structural and social determinants of health, although there is much more to do. I believe the number I saw is around 2/3 of medical schools offer instruction in advocacy, but most of it is elective. So we do still have our work cut out for us. And then there's broad consensus among health organizations that climate change is a profound issue of health inequity. And why is it so important? And I don't think I need to relate to most people that are probably showing up here that our voice is powerful. And I think Jasmine said this as well. Your voice as students is very powerful. Your voice as health professionals is powerful. We live in a media landscape that is really noisy, and it's hard to know who to look to or to trust. When health professionals speak, with nurses, medical doctors, and pharmacists being some of the most trusted voices to the public, people actually listen and they want to hear the information that we have to share. So I think we'll get to this in the panel portion. So I'll just wrap up quickly to say that we can play our part to get our patients registered to vote. We can talk to our patients about climate change as a health issue to depoliticize it and build collective will. And we can press our elected leaders, particularly during election years, on bolder climate action. And we have some resources that we're developing here at the consortium to help you do that.
Well, thank you so much, Lisa. That really galvanizes our understanding that this is our lane. And so far, we've seen that climate change is a public health crisis, even I'd say an emergency, that voting is a social determinant of health, and that when patients vote, their health improves. Our trusted voices are so powerful, and we have a unique connection to those patients, many of whom most harmed by fossil fuel pollution and the climate crisis, yet are not registered or consistent voters. So voting is a climate solution, and this is our lane. I want to share this quote from John Lewis, and can you show that as a full slide view so people can read this?
Am I not?
No, we're seeing all your speaker notes and times, and it's not the slideshow view.
I'll try. I'm sorry.
But what it says is the right to vote is almost sacred. It's the most powerful instrument we have in a democratic society. We must use it. And I'd like to point out that we need to use it in every election and for local offices. Local elections are often decided by a small number of votes that will have a huge impact in 2022. We're still not seeing the slides. If you can
Yeah,
go to
I'm
the
sorry.
slide.
I don't know what's happening. So
Oh, I think it's coming now. There we go. So in 2022, decisions will be made about the distribution of resources from the Inflation Reduction Act, the infrastructure bill, regulations that will determine whether our children have clean air to breathe and a safe climate to live in. So this really, really matters. Next, please. So some of you may be asking, is this too much to ask of health professionals? Just one more thing? Can we do that? And I would counter to say that this may actually be an antidote to some of the problems that we have in healthcare, the moral injury from being unable to provide the care that patients need, that Vivek Murthy discussed in his recent New England Journal of Medicine article on burnout. And in fact, we hear patients say things like, gosh, if a doctor told me I could make a change by voting, I would be, yeah, totally. It shows they really care about us. So patients like it. And physicians who do this say, this has been great for my own mental health, this emergency doc in Ohio. So I think this can be a boon, not a burden. And with that, I'll turn things over to Jasmine again to talk to us more about Vot-ER and their tools. And I want to take just a moment to recognize that Chelsea White-Hoagland, our main connection with Vot-ER, is here in the audience and will be available in the question period as well. Thank you, Chelsea. Jasmine, you want to share a screen now? Oh, you are.
But you're on mute.
Yes, I'm here now. I just wanted to start by saying sometimes you can select which screen to see if there are multiple screens being shared. So you should be seeing a screen that says why Vot-ER right now. So as is mentioned, I am a Vot-ER intern in addition to being a medical student and a PhD student. So I'm really passionate about the work of Vot-ER because I think it really fits well in what my goals are for my own practice and my developing practice at this point. But I also think that it's a way for, as Dr. Mahoney mentioned, physicians to feel engaged in improving patients' lives outside of the clinic. And so Vot-ER is a 501c3 nonprofit organization. It's a nonpartisan organization that works to really make voting and civic engagement part of the patient-provider relationship, making those conversations easy to have and making the tools accessible for patients. So Vot-ER has been expanded to over 500 hospitals and clinics throughout the nation, and we've helped more than 47,000 people vote since 2019, whether that's registration, ordering absentee ballots, and we've been really working hard. So the law actually supports this work. Sometimes folks do feel a little bit nervous about getting into this space, especially since the resurgence, I think, of a lot of partisan, political, manipulative rhetoric that makes people shy away from this issue. I think that the law supports us in really being as transparent and encouraging as we can as we guide patients in this idea of voter engagement. And so what I'd like to do is kind of encourage you all to see how you can engage your patients in this work through Vot-ER's tools. And so I will give you some QR codes that will take you to some links to order some of your own tools, but we have badges, handouts, different posters and other paraphernalia to be able to use in your clinical setting, however it's easiest. I want to emphasize that our tools are nonpartisan. They're not meant to be disruptive, and it will allow patients to do their own work in getting their own registration done, but to be able to always have you as a support as well. So we want to emphasize that voter registration belongs in healthcare. We're used to voting kind of being in the libraries or community centers or in the DMV as far as registration is concerned, but we'd like to reimagine this to be really relevant to the healthcare setting, to have confidence. And as one of the speakers mentioned, the patients and healthcare providers, we're trusted folks who in people's lives, and this topic is really belongs in this space. And so we also know that when nonprofits partner with healthcare providers, we see that these this effort and this work that we're doing is even more effective. And so we are able to see this in the data and also in communities who have historically and are ongoing and who continuously experience barriers to voting access. And so I want to share with you all a little bit more about how to get involved. We'll be doing a little bit of role play later, which I'm looking forward to. But we want to I wanted to depict this badge in action. If you see the video here on the right, you can order your own badge, and I'll get to how to do that. The badge, that's what it looks like up there in the corner. Again, these tools should be non-disruptive and they are non-partisan. And so if you have your phone on you, this would be a time to really start to get active. And you've been hearing a lot of information and you've been hearing about folks' journeys in the advocacy space. You can start your own advocacy journey here with this QR code. If you scan it, you should be able to see whether or not you are registered. And so making your own voice heard is one of the first steps that we have to take before even approaching this dialogue with our patients. And so if you will, take your phone. I don't want to skip through this in case y'all are still unlocking the phones or getting to the cameras, but see if you can scan this QR code and then go ahead and follow the links to check your registration status. And I didn't mean to say that would start your advocacy journeys. I know that there are some really seasoned advocacy veterans here and those who are still continuing the ongoing work. But I also wanted to add something to your toolkit. If you scan this QR code, you'll be able to get to a page which should lead you to how to get your badge. And there's also some more materials that are located or that can be found in this kit. It's a free Healthy Democracy kit. So go ahead and scan that QR code. I'm going to try to buy a little time here for you to open up your cameras and get to that QR code. And if you have any questions, please feel free to drop them in the chat so that I can address them and try to get you the information that you need. So you can also on the Vot-ER website, while you're on the website getting your badge, poke around and see what interests you. There's a lot of resources on the website. Folks have spent a lot of time trying to make these resources as accessible and comprehensive as possible. If you go to the resource tab on the top, you'll be able to also access some conversation starters. And once you get your badge in the mail and are ready to use it, these can be really helpful as you start to use that tool. And so I'm actually going to pause here and hand it off to Eve, who's going to get us started in some role play around these conversations. I will stop my screen share now.
Okay. Hi, I'm Eve Yalom. I'm a practicing OBGYN at La Clinica in Oakland, California, and I've been using this for a while. And I have to say, when I first started doing this, I found it quite daunting. But as I keep doing it, it feels more comfortable. And as people have said before, it actually gives me hope that something is happening in our larger life. So there are two places that I find most useful to discuss voting registration. It can be either in the social history when you talk about smoking, alcohol use, feeling safe at home, and then you can ask, do you vote? And in some institutions, the social history, which includes voting, is now part of the electronic medical record. So that can be a really great thing to put in your medical record, so then if they're up to date on that. Or the other place is, at sort of the end of the appointment, after the physical, before they leave. So we're going to act out, me and Vanessa and I are going to act out, a basic interaction, and then we'll try one that's a little bit more complicated. So I'm going to go in and see Vanessa, who's brought her daughter in. So I guess we're going to.
Sorry, Beth, do you mind stopping screen sharing, Beth? Thanks.
So, hi, Vanessa. How are you doing today? What's going on with your daughter?
Well, Doc, it's not been a good day. My daughter has asthma, and I had to pick her up from school today because she was having trouble breathing. It's just, overwhelming.
Wow, that's kind of hard. And I know you've been working with this for a long time. So then we'll go through the history, we'll go through the physical, and then, when we're done with that, I'll say something like, before you go, I want to discuss something that turns out it's really important to everyone's health, and that's voting. A lot of people think they're registered to vote, but they're not up to date. Do you know if you are currently registered at your current address?
You know, I don't know because we moved recently, so I'm not sure.
Well, it's really easy, really easy to register to vote. And I'm going to show you my QR code. I'm going to you can take a look at this. You could take a picture with your phone, and that'll take you to a site. It's totally nonpartisan. It just takes a couple of minutes, and then you can share it with, anybody else in your family or anyone else you know.
Gee, that's easy. I think I can do that, Doc. I'll do it and make sure my partner does register as well. Okay,
that's great. That's super. That's wonderful. Sometimes it's a little more complicated. I'd say like 90% of the time, 99% of the time, that's about all you actually need to do. But sometimes it can be a little bit more complicated. So I try to find something that's more relevant to the patient's health or something that they care in. So we're going to sort of reenact the same scene, but change it a little bit different. So let's go back to the last patient when she's about ready to leave, and I'll say something like, in addition to the meds and the treatment that we're doing, one thing that's going to help your daughter's health is you voting. And I encourage all of my patients to vote. And do you know if you're registered to vote at your current address?
I don't think I'm registered. I just don't do politics. Voting doesn't matter.
Can I ask you why you don't vote?
Well, again, I just doesn't seem to make a difference. Nothing gets done.
Yeah, I can hear what you're saying. I mean, it's a hard time, but actually you do have power with your vote. We all do. And there's so many elections that get decided by just a few votes, and that's especially the local elections. And these are the places that decisions get made that affect your everyday life, like air quality. And the people who we vote into government, they listen to the people who voted for them. So I'd really encourage you to use your power to vote.
Okay, I get what you're saying. You're convincing me. I'll register to vote.
Okay, I know that you're going to feel really good about it, and it's going to affect other people's lives in addition to yours. Okay, great. One situation that comes up is what to do or what to say to somebody who's undocumented. And the Vot-ER has convinced me that even people who can't vote, it's worth bringing this up. So after asking if they're registered, and people will say, no, I'm not, I'll say something like, thank you for sharing that with me. But even if you can't vote, there are things you can do to help your friends and your family who are citizens and get registered to vote. And I get a lot of really positive response about that. And I'll say, here you can take a picture of my badge again, or I'll often just hand people out these flyers that we have posted around, and you can put them in black and white, and we have them in Spanish as well. So yeah, so if you have any questions, let's put them in the chat, and let's hand this back to our speakers.
Thank you so much, both of you. That was super helpful and fun. So I'm Karina Mayer. I wanted to bring back our speakers. They're available for any questions that anybody has. And then also Chelsea from Vot-ER, I saw you here. If you want to introduce yourself also, that would be good.
Sure. Hey, y'all. My name is Chelsea White Hoagland. I use she and they pronouns interchangeably. You can pick one or use either or. And I am Deputy Organizing Director with Vot-ER. My background is in social work. I have a bachelor and master in social work and have been in community organizing for about a decade now, doing a lot of healthcare advocacy around Medicaid expansion and some other important issues in my home state of North Carolina. and have been excited to work alongside of our Climate Health Now crew as someone who previously worked on an environmental campaign in a past life. So happy to be here and help answer any questions.
Thank you so much for joining. If anyone wants to talk, they can too. Amanda put in the chat, I'd love tips for talking to our office administrators who are reluctant to let us put up posters about voting. Yeah, that would, I'm sure, be a common situation just in general, how to get it all done. Who wants to talk about that?
I can say I worked on it in Kaiser Permanente, which is a highly bureaucratic organization. And I mean, it's really just a matter of kind of going through the steps and, you know, obviously, as with all things, like trying to find allies who believe in the cause and just going through the processes. But, and it can take a long time. So now is a great time to get it going. But I think it's just a matter of finding out like who has the permission to make those decisions, which can be sort of challenging for big orgs. But I think there's more and more acceptance too, so.
Yeah, and you don't have to use the poster. You can put it on the computer screen and have the QR code there. That's easy, I think, too. Ashley, since you're on, you had mentioned that the AMA has a strategic plan for how we will enact climate change policies. Do you have any notion how we can influence that or how we can help them see that civic engagement is part of that plan?
Well, so it's coming out next year. And as I understand it, there's one particular AMA staff person, Andrea Garcia, who's kind of getting a lot of feedback from different people. So I think she would be the person to receive suggestions. Yeah.
Okay, because I think that would be helpful. And then Jasmine, and maybe Ashley too, if you wanted to comment after Jasmine, did you find that when you were working on the resolution that AMA members, that most of them understand the importance of social determinants of health and also that voting is a critical one to recognize? Or do you feel like we as health professionals have a long way to go to understand both the broader social determinants of health and that voting's one?
Yeah, so the experience of going to the annual meeting and speaking at the reference committee hearing on this resolution was a very eye-opening one. I was so grateful for the supporters who were able to line up behind me at the mic, and the mic says pro to provide support, but there's another mic that says con on it. Those of you who have been to these reference committee hearings know. But there were folks at the con mic, and I won't go through who they represented or who they were, but they really felt strongly that voting was not a social determinant of health, and they went into different arguments about the aspects of the resolution that they didn't like. That was not surprising to me. I know that as someone who experiences racism, sexism at an intersection in society, and who is a first-generation medical student, and who is navigating kind of life as a Black woman in medicine, I knew that there would be resistance to trying to elevate all folks and bring equality and equity, more importantly, to this. I do think that the AMA has done a lot of work around making sure that physicians understand that there is a unified message behind these issues, whether it's climate change or voting. Part of why the AMA would pass a resolution is so that they can have existing kind of policy to reference when they are, required to speak on these things. And so I think that it's very powerful that we would provide them something that they can say, hey, this is our unified message. Voting is a social determinant of health. So no matter who has what to say, the AMA's position is this. That's why I think that this work is really important. But absolutely, there were naysayers. Thankfully, they did not win. And we can continue on in this work proudly and loudly. And I'll pass it off to Ashley to provide her experience.
Yeah, I think there's just, when the AMA spoke about gun violence and the need to regulate firearms to protect people, the NRA came out strong saying, doctors, get in your lane. And I think that really captures a lot of the challenge. Like, a lot of doctors want to stay in their lane and they want to use the AMA to make more money. And they tend to be older and they tend to be in positions of power. Like my work in this coalition building for this resolution, you know, there's something called the Ghost Caucus, which is the medical students, the residents and fellows, the ethnic and minority section, the kind of women section. So these groups have a more progressive, holistic sense of what our obligations are as physicians and what contributes to health. And they're actually interested in fulfilling more of the mission of the AMA, which is the betterment of medicine and public health, and really the public health part, which hasn't been the historic strength of AMA. So I think it's really about a change of the guard. And although it's more work, I think a lot of the kind of conservative agenda has been advanced in terrifying ways, because their strategy is not to change the system, but to become the system. And I think that's what I see our opportunity being, is taking up these positions of power in AMA, in any policy making body, and really making it advocate for social justice, health equity, all the facets that make society more fair and healthier. So it's really uncomfortable. I've had AMA leaders tell me that the climate's always been changing. Like, these are leaders, and we got to take their positions and make change.
Well, thank you for you change makers. We're happy and that you're doing your work. We're going to wrap up our Q&A in just a couple minutes. There's a few in the chat that Chelsea has offered to answer about Vot-ER. So one is from Ilana. Do you all include tips around finding voting info and avoiding mis/disinformation when talking about voting? And does Vot-ER have tools that help us approach administration? And then I think, Cynthia, you'd asked a couple more about there. Do the Vot-ER tools incorporate the AMA resolution? So Chelsea, thank you.
Yeah, absolutely. And I did want to touch on the question also from earlier about talking to office admin who are reluctant to let y'all put posters up about voting. And I think one of my kind of notes that I keep in my mind as a social worker is to remember to meet people where they are. And so sometimes it's that posters aren't the right move at this moment, and we can work in that direction. And maybe it's like we plant the seeds by recruiting our colleagues one by one to order and use an individual badge until we have some grassroots power that can then approach the administration as like a group with a well thought out kind of like talking points and argument for using the materials. And for the question about tips around finding voting info and avoiding disinformation when talking about voting. So we do have conversation starters on the Vot-ER website, and those help address one, like how to actually start the conversation, whether it's during their assessment or at the end of their visit or at some other point in time during their visit. And then there's a couple of situations around voters that feel skeptical, like, oh, well, it's all rigged anyways, kind of mindset. And then some talking points around voters who do feel powerless and disenfranchised, and how to appeal to different types of demographics within those groups, like young folks, et cetera. And I think that one thing that we really encourage providers to remember is that, like, actually it's okay if your patient walks away and is like not totally bought in, right? I think that I like to lean on motivational interviewing, which is we actually kind of gauge where someone is on a scale of like 1 to 5 of like readiness, right, to jump in and participate. And I think that like what we really want to avoid is just like trying to double down and like not, like really trying to convince them that this is something that they need to take action on, instead of approaching it from an angle of like, I just want you to have this option as like a tool in your tool belt for all of the ways that you can take action to address your own health and well-being. And whether or not you decide to show up to the polls is totally fine. And then when it comes to like information about when the polls are open, the landing page will actually point folks towards, as we get closer to the actual early voting days, et cetera, we'll point folks towards healthyvoting.org, which gives folks information depending on the state that they live in about accessible voting opportunities like curbside voting, and when the polls are open for early voting on election day, et cetera. And then also Vote 411, which is more of a ballot breakdown, like what's actually on the ballot. And then in those offices that you're voting for, what do they actually have power over? And I think that it's best practice for providers to avoid giving any recommendations about policy or candidates or parties that we support. I think the best way to go about, if someone says like, I don't know who to vote for, do you have any recommendations, is to say, oh, well, I would really encourage you to look at a website like Vote 411, or talk to family and friends who share the same values that you do. And then the other question about, do we have tools to help you approach administration? Yes, there's a resources page on Vot-ER's website. The top menu says resources, and you just click on that and it has all kinds of goodies. Close to the bottom of the page, you'll see a couple of different types of slide decks that you can make copies of and edit to suit your purposes. They've got different depths of information related to civic health. And
Oh, yes, sorry to interrupt. I did put that in the chat so people can see
perfect.
the resources page, but thank you so much, Chelsea. In the interest of time, it's almost 1:30 and Margie's going to wrap up for us. But Lisa, I wanted to just give you a chance if you wanted to put one last word in for the consortium and how you're supporting civic engagement, and just if you had any 15 seconds that you wanted to say.
We'll just drop the link in the chat for folks and check back because we're still developing some resources. So it should be a live site where we're updating resources throughout the elections.
Perfect. And thank you so much, everybody. Margie.
Okay, thank you so much to all our speakers and especially to all of you who have joined us today. Using Vot-ER to register our patients and colleagues to vote gives them a powerful voice to demand a healthy and safe environment. And the AMA has reinforced that civic engagement is in our lane. I want to acknowledge and thank our passionate, committed Voting for Climate and Health webinar planning team, Vanessa Forsyth, RN, Dr. Eve Yalom, and Dr. Janet Perlman. Watch for an email with the recording and more information about how you can bring Vot-ER to your own institutions. And thank you and goodbye.
Thank you, everybody.
Thanks, everyone.
Bye.
Bye.